I'm Master Sergeant Brandon Blake. I'm the detachment superintendent for the Special Operations Surgical Teams at the University of Alabama-Birmingham. Battlefield surgery is one of the key components of the pillars of special tactics. Having a Special Operations Surgical Team, being able to get as close to the fight and as close to the injury as possible ultimately saves lives, because minutes truly matter when you think about trauma and you think about injury patterns that we can see on the battlefield. What also made me interested in SOST is just stepping out of my comfort zone. It was going and doing something that was bigger than myself, being able to work with the type of teams that we were able to work with, being able to work with operators and be their front line for medicine if something happened to them, to ensure that we get them home to their families if something happens. The types of training that I've gone through to be on SOST, we go through special operations medical courses that are usually at other bases. We do a lot of interoperability. We'll work with other teams to be able to understand their TTPs. We go through the CCAT advanced course. So we have to make sure that we're validated at the critical care advanced course. Go through a lot of combat medic type training as well to really get us outside of the hospital. The military-civilian partnership that we have with the University of Alabama-Birmingham is truly one of the things I want to highlight. That is one of the biggest successes for us on teams. Being able to work inside of the Level 1 Trauma Center, the third largest and busiest hospital in the nation, is one thing that we get to do every single day when we're not out doing all of our pre-deployment training and taskers. Is hands down some of the best training that we're able to get. We also have Detachment 2 over at the University Medical Center in Las Vegas, Nevada, and they're able to do the same type of work that we are at Det 1, keeping our medical skills peak so we can go out and do our job and save someone's life if we need to. We also do a lot of small unit tactics training just to make sure we're familiar with our weapon systems we're utilizing. SEER, we go through survival school, is some of the other schools that we've attended, and that's just to get you baseline to be able to get onto teams, and that usually encompasses our pipeline process. So SOST deployments can be challenging. You're not really sure what you're going to get into, whether it's a short notice alert tasker or an enduring tasker where you're actually going for 6 months at a time. Problem with it is you're packing med supplies, you're packing all of your equipment to try to ensure that you can take care of a large amount of patients during that time frame. The most challenging part of it is the limited access you have to logistics, the limited access you have to medical capabilities, whether it's blood, whether it's air transport out. And you just got to know that when you're on the ground, you have to be self-sufficient and be able to do your job without really help coming from any which way. Qualifications to get on the Special Operations Surgical Team comes down to your medical training and medical proficiencies. So as a emergency medicine physician, surgeon, having your residency almost taken care of and knocked out when you come over to teams and getting ready to challenge your boards is one thing we look for. We also look for your registered nurses to have their CCRN, which is your critical care registered nurse certificate. For our respiratory therapists, your RRT, which is your registry, which now is actually mandatory for all respiratory therapists coming over. And then for our surgical techs, we are now working at getting them into the surgical first assist program at the University of Alabama-Birmingham and at UMC. So if you're looking at getting into SOST, I recommend getting outside of your comfort zone when it comes to medicine. Get physically fit, work out, be able to meet the challenges and the demands of being downrange and working with a 55-pound ruck on your back, including your helmet, your kit, and understanding that environment you're getting into. So all your credentials done, good positive mental attitude, physically fit, and ready to tackle the challenges that are ahead.